Welcome to today's Aligned Modern Health Digital Doc webinar. Today we are joined by Dr. Hovig Vartanian from our Functional Medicine and Clinical Nutrition team, and he is going to provide a functional medicine perspective on inflammation and the gut-brain connection. Before we dive into today's topic, we'd just like to give a brief overview of Aligned Modern Health in case it's your first time joining us at a Digital Doc webinar. Aligned Modern Health is the Midwest's largest integrative alternative medicine provider. Alternative medicine simply means no drugs, no surgery. At Aligned Modern Health, we really aim to get to the root cause of why our patients are feeling what they're feeling and not just focus on one siloed symptom or condition. We really take a whole body approach to healthcare because you are a whole person with all different systems that work together to make sure you are able to live your life to the fullest. Each of our 18 clinic locations throughout the greater Chicagoland area are supported by several different core services, and some of them are available via telemedicine throughout several US states. Our in-clinic services include a physical medicine practice, which is supported by chiropractic care, injury prevention and injury rehabilitation, athletic performance support, and clinical massage therapy. Our in-clinic acupuncture services are amazing benefits to physical pain, both acute and chronic, and also support some intangibles and internal conditions and concerns. Stress, anxiety, depression, sleeplessness and insomnia, men's and women's health and hormone balancing. We have a nationally recognized fertility support program. We support fatigue and fibromyalgia and seasonal allergies. We also offer some other modalities under the traditional Chinese medicine umbrella, including cupping, moxibustion, and customized herbal medicine. Our functional medicine and nutrition team is available in clinic and also via telemedicine in several US states, including Illinois, Florida, and Colorado. This is a great practice to better understand why you're feeling what you're feeling externally by doing a deep dive internally. We support a lot of gastrointestinal issues and autoimmune disorders, bloating, constipation, fatigue, migraines, food sensitivity testing, men's and women's health and hormone balancing, hormone replacement therapy. We also offer nutritional counseling as a support of this service, as a lot of times lifestyle changes are needed in a treatment plan, and those are hard to manage on your own. We definitely want all of our patients to feel very supported in their journey. Aligned Modern Health is in network with most major insurance providers, and we are happy to help you investigate your benefits if you are interested in learning more. And we also offer free 15-minute consultations. These consultations are an excellent way to speak directly and privately one-on-one with a provider to have your questions answered and better understand if these services are right for you. Speaking of questions, we absolutely encourage your questions here on today's topic of inflammation and the gut-brain connection. You are welcome to type your questions anytime into the Q&A feature of Zoom. That is the Zoom icon with the two little conversation bubbles labeled Q&A. We will address questions at the end of the talk. All of that said, it is now my pleasure to welcome Dr. Hovig Vartanian to the conversation.
Hi, everybody. My name is Dr. Hovig Vartanian. I am a functional medicine physician at Aligned Modern Health. A little bit about my background. I have 2 bachelor's degrees in exercise physiology and human biology. My doctorate is in chiropractic, and my postdoctorate is in clinical nutrition, which I received that in the mid-90s, and it's eventually has transitioned to something called functional medicine. I've been practicing functional medicine essentially since that time, and it's it's an integral part of what I do on a day-to-day basis, and I'm specializing on that right now at Aligned Modern Health. So today's topic is regarding inflammation and how it affects the gut-brain axis. A lot of people have heard of the term inflammation, and it's been quite the buzzword in the last, I'm going to say, 10 years. But not many people really know what inflammation is. They kind of have an idea, but there are subtle ways that inflammation affects us in good and bad that can determine how our health outcomes are on a day-to-day basis. So most people know of inflammation as something that happens when you injure yourself, whether you are jamming your toe, twisting your ankle, ingesting a bacteria, or you're exposed to some kind of environmental trigger. You see the swelling that's in your toe or your ankle. If you ingest the bacteria, your body wants to get rid of it right away, and you have an inflammatory response that does that. An environmental trigger. So if you have an allergy of some sort, or you are allergic to a particular food, you might have an anaphylactic reaction, unfortunately. Those are more inflammation that happens in an acute fashion. But what about the ones that are more subtle and they're chronic and it's happening over and over again? Those are the ones that happen over time, and it starts to affect our system in a way where it's very subtle, but it also has a very deep impact to us on a day-to-day basis. One way it affects our GI system is when it affects our gut microbiome, which is our good bacteria that is in our colon. We want that good bacteria there because it produces a lot of good metabolites that keeps us healthy. Those metabolites, in turn, help our immune system and hormonal system. And at the end, the neurotransmitters, which is what is connected with the GI system in our brain. So we'll talk more about that later on in greater detail. So how does functional medicine measure inflammation? The old way of measuring inflammation, which is still done today, and it is effective, is a measurement called sed rate, where they measure red blood cells and they kind of time how fast the red blood cells sink to the bottom of a test tube. And usually, the higher the number, the worse it is. It doesn't tell you where the inflammation is or what kind of inflammation you have. It just says you have it. So it's kind of a screening tool for us that we use on a regular basis. Next, we use something called high-sensitive CRP. CRP is primarily used as a marker to mitigate any type of cardiovascular risk. Higher levels of CRP numbers can indicate that you have some kind of inflammation happening in your arteries, but can also tell you whether you have some kind of infection going on. The number gets higher and higher. So that is where, as functional medicine physicians, we have to discern what that number actually means as it pertains to you. If we were to ascertain that you do have some kind of GI issue and we wanted to do a stool test to find out exactly why you're having some of these issues, we would do a stool analysis. And in that stool analysis, another way to measure inflammation is something called calprotectin. What calprotectin does is that it measures a distinction between IBS and IBD. When high levels of calprotectin are found in a stool test, it's usually an indication that you might have something called irritable bowel disease, which is a much greater risk than irritable bowel syndrome. If the number is really high, at that point, we would have to refer you to a gastroenterologist. If it's on the lower end, but still not quite perfect, we can treat you to make you improve. And if you do improve, great. If you don't, again, that is when we would refer you on to a GI specialist. Once we did start treating you, one of the other ways we measure to see how you are improving is a marker called lactoferrin. Lactoferrin is also a great way to see how my treatment plan is working out for you as far as your symptoms go and as far as what's happening to you physiologically. So based on that, I'd like to talk about what happens in the gut when we start eating the food and how it ends up in the large intestine, and how it impacts our body. So, as most of you know, your GI system starts at your mouth and ends at your anus. It's very, very important to understand that because throughout that whole process, everything that's happening is happening to break down food, absorb macro and micronutrients, try to keep out the bad nutrients, and getting rid of the waste. That whole process is an important way of us getting healthy nutrients into our body And if that process is not done efficiently or in a timely manner, then you start having some issues. So starting with the month, it's very, very important to make sure that the food is being broken down very well in the mouth. And chewing plays a great role in that. That is where we are mechanically breaking down the food. You know, I constantly reach out to patients when I'm talking to them and I'm asking them, how do you eat your food? Do you take your time? Do you chew your food thoroughly? And by the time you are chewing it, do you swallow it where it's almost liquid in your mouth? And the reason I ask that is because if you are the type of person that's eating fast, you're just sitting at your computer desk and inhaling your food, you're essentially asking everywhere, all the other parts of your body to break the food down for you. And really, most of the food should be broken down in your mouth. That's where it mixes with your saliva, where it has all these different types of enzymes that helps with the breakdown process. And the mechanical grinding of the food also plays a big role in it. This kind of reminds me of a great story I once heard. It was about a Chicago Bear player named Richard Dent. When he was originally drafted by the Bears, he wasn't drafted very high, mostly because he couldn't put on any weight. He had great talent, but he was 20 to 30 pounds lighter than most people were at the position he played. And when he arrived at the Bears, they noticed that his teeth were really bad and he had pain when he was eating. So they sent him to the dentist and he was able to fix his teeth. And eventually his chewing became a lot more efficient and he was able to put on another 30 pounds of muscle. So chewing plays a good role in helping us break the food down and digesting it. Once we chew the food and we swallow it, something called peristalsis starts again. Peristalsis is a way of our body using muscular contractions starting from our esophagus all the way down to our anus to help push the food along little by little. And it's controlled by your brain and particularly a nerve called the vagus nerve, which we'll be talking about in a little bit. It passes through the esophageal tract. And once it passes through the esophageal tract, it ends up in your stomach where a lot of the protein starts to break down. And the protein starts to break down primarily with the stomach acid and the pepsin you have in your stomach to help break down the protein that you have just consumed. And contrary to popular belief, as we get older, we don't make more stomach acid. We tend to make less stomach acid. So it's really, really important as we get older, especially, to really chew our food. Because of us not making enough of that stomach acid, you are really relying on that stomach to make your food break down further. This is kind of where, during our history, when I talk to people and I ask them, what kind of foods make you bloat if they're complaining about bloating? And if I notice that it's primarily protein in nature, I know for sure at that point that they have some issues making stomach acid. Once it goes through the stomach, it ends up in the small intestines, and that is where a lot of the absorption of macro and micronutrients take place, which is very, very important. That is where the rubber meets the road, as they would say. A lot of things are happening at that point. And of course, it moves on to the large intestines after that. Interesting thing about the large intestines is that's when pretty much everything that could be pulled out of the food that you ate ends up, and it's usually mostly soluble and insoluble fiber and water. And the more dehydrated you are, the more water your large intestine will pull out of your feces. And sometimes when someone is constipated, this is why drinking water on a regular basis and having a good amount of electrolytes in your water is very important, because if you are dehydrated and you are not getting a good amount of hydration, you will end up pulling water out of your feces and into your bloodstream to balance out your hydration. And the feces that you will have left will be hard and dry and hard to pass. And of course, at that point, it goes through your rectum and out your anus at that point. The consistency of your stool is very, very important and very telling. So when I do interview the patient, I will ask, I will ask them how often they go to the bathroom on a daily basis, whether they have smooth and well-formed feces, whether they float, if there's any blood or mucus in their feces, and also if they're in a bunch of little pieces or if they look like a banana. Those all tell me something that is going on inside your intestines, and it gives me an idea of what to do next as far as your testing goes. So this is the small intestine is what we were going to talk about. This is where a lot of the micro and macronutrient absorption takes place. Macronutrients are the carbohydrates, the proteins, and the fats. They're broken down into sugars, amino acids, glycerol, and fatty acids. And the micronutrients are the vitamins and minerals. So if you look at the picture down to your left, you see two different pictures of the cross-section of what we call the villi. The villi are like the finger-like projections in your colon that help absorb or keep out the bad things that you're not supposed to have on a regular basis. So you look at what the villi look like on the left, which are long and protruding, whereas the ones on the right are kind of beaten down. And when they start to become flattened out like that, they lose the surface area. The absorption of your nutrients become less and less, including the micronutrients and the vitamins that are important. This is why sometimes when you are giving a patient a supplement protocol, if they're not responding as you would like, usually there's an issue with the absorption, and that is something that we have to investigate a little further by doing other testing. So the primary function of the small intestine is breaks down into three different sections. One is called the metabolome, and that is basically the different good bacteria that's in your small intestine and large intestine. And the terrain itself, the terrain is the physical nature of it, and that's the long finger-like projections that we were talking about. And the gastrointestinal glycobiome, that's basically the immune system, as well as the mucus layer that is on top of the life. So the primary function of all three of those systems are to balance water and electrolytes. They prevent the influx of different types of pathogens, toxicants, and antigens. Antigens are foods that are not broken down properly and are being absorbed in a way that's causing you to have allergic type reactions. And they also regulate the immune system. So you respond in a proper way, whether they are over responding, which is an autoimmune reaction, or they're under responding and your immune system's been beaten down and you have chronic infection happening at that point. It also manages the good bacteria versus the bad bacteria. That's so important in the long run. So if that breakdown occurs in those three barrier systems, you start to develop something called intestinal permeability. Some of you might have heard of it as leaky gut. Basically what it means is one of those three, if not all three systems, have been compromised. And some of the things that cause that compromise when it does start to break down is when you start to have changes in your microbiome. If you're not eating a well variety of foods that help you create different types of bacteria that are important to help maintain the structure and function of the intestines, you start creating some issues and the breakdown of those tight junctions start to occur. Other things that start to happen that affect that are your lifestyle factors and dietary factors. The two most common ways are excessive consumption of alcohol and dietary factors, which include the Western diet and eating the ultra processed foods. I call it the gas station diet, where most of the foods are packaged foods and you're trying to get rid of all the different types of chemicals and preservatives that are found in those foods. Pharmaceuticals like prednisone, NSAIDs, and antibiotics. If I notice that you have that in your history where you were using that over and over again, there's a good chance that you have some type of intestinal permeability occur. Environmental xenobiotics include any type of chemicals that are in the air that don't belong in our body, that we are ingesting or breathing in, and eventually end up in our GI system. Any type of cancer treatment, including radiation, excessive heat, exercise, or stress, obesity, and overconsumption of saturated fats all contribute to breakdown of the gut lining. So once we assess that you have an issue with your gut, we want to assess what that issue is and how do we go about addressing it. And it's different for everybody. I can have 10 IBS patients and I will treat them all differently based on what I find on their labs as well as their stool markers. So one of the ways that we find out what's going on is we measure the different types of bacteria that are in your colon. The good bacteria should all be at least +3, if not higher. +4 is ideal. The commensal flora, those are flora that is a little bit as good, too much starts to create problems. And the dysbiotic flora, which is the one in the red, whenever I see any of those, we need to get that out right away because that's causing havoc too. So what I like about the test that we do is it also runs a sensitivity profile. And what that sensitivity profile does is it tells me that exact bacteria that was in your colon that they found, they will put in different types of Petri dishes, and they will tell me what does the best job of killing it. That way, there's no second guessing. I'm not trying to find out which antimicrobial or antifungal or antiparasitic is going to do the best job. The lab test will tell me. So this saves us at least 5 to 6 months of time of experimenting and finding out which ones are doing the best job. If it tells me that you need some type of antibiotic or pharmaceutical, we have a doctor on staff that can prescribe, and we will refer you to him at that point. So based on that, what are some of the things that you can do to help maintain your lining of your gut? So prebiotics are very important. Prebiotics, I call them kind of like the fertilizer for your gut lining. You need to have a good amount of these prebiotics to help the good bacteria flourish and help keep that mucosal layer intact. Some of the things you can do to help with that is consume onions, garlic, asparagus, leeks, yams, artichokes, chicory root, agave, and bananas. There are certain prebiotic formulas that we also suggest when people are really averse to eating those type of foods. We always try to get the patient to eat the foods ideally, but in the beginning, when they're having the problems, we want to get the supplements in them to get them up to speed as fast as possible. But once they start to stabilize, I want them to start eating those foods because that's what's going to keep them well in the long run. Another way is to maintain their immune system by maintaining their secretory IgA. Secretory IgA is basically a way of, it's an antibody that helps figure out what is good and what is bad in your intestine, and it attaches to it, and your immune system attacks it and kills it. So a good balance of that is something that's really, really important. And some of the things that helps maintain that are omega-3 fatty acids, olive oil, vitamins A, D, and zinc. Different types of probiotics help with that as well. Prebiotics, of course, and glutamine and arginine. One of the things I see over and over again in my practice is most people have very low levels of omega-3 fatty acids, especially in this area because we don't live on the coast and we don't have access to good fish. We don't have good levels of omega-3 fatty acids in our diet. So I find that to be a problem for most people. Another way you can help maintain those tight junctions is making sure your vitamin D levels are within the optimal ranges. So some of the foods that help with that are trout, salmon, tuna, sardines, mushrooms, egg yolks, and if you can tolerate dairy, fortified milks, yogurts, and cheeses. So now you're at this point, you're saying, great, doc, I know all about the gut. What has that got to do with my brain? So we know that the brain is attached to the nervous system. And the nervous system goes from the brain to the brainstem and out to the periphery, to our hands, our organs, and helps control them. But not many people know that your colon also has a nervous system all its own called the enteric nervous system. And it is connected to your brain by a main conduit called the vagal nerve. And that conduit is very, very important in helping that peristaltic activity that we talked about at the beginning. So when you don't have good connections and good messages that are being transferred back and forth, that peristalsis does not work as well. And the messages that are being sent to your brain via neurotransmitters are become aberrant and it starts affecting your brain in the long run. It's gotten to the point where they're looking for surgical implants, and I know they have started using this already to help stimulate the vagal nerve. We try to do it in more of a conservative fashion by suggesting breathing exercises. And when we do the breathing exercise, we ask, there's many different kinds, and we choose the kind that is the right one for you. And we also ask you to do it at a certain time that'll be the most benefit to you as well. Meditation, gargling, singing, stimulating the gag reflex, and cold showers, which is part of something called hormesis, all stimulates the vagal nerve. So when you have that stimulation, the stimulation is being done by neurotransmitters. Neurotransmitters are little chemicals that send messages from one part of the nervous system to another, and it tells it what to do. And those little messengers are very, very important in how our mood is on a day-to-day basis and how our ability to handle certain types of stress and how we feel about other people as well as ourselves. There are over 140 different types of neurotransmitters, and they're still discovering more. But the 8 main ones that relate to when it comes to mood are the ones that we're seeing on our screen right now. Adrenaline is something that a lot of people have heard of, and that is the fight or flight neurotransmitter. You know, if you are being chased by something that's creating danger to you, adrenaline is released. And it is very important to our survival. We need that adrenaline to survive. And along with the adrenaline, we release something called noradrenaline. The noradrenaline helps you focus on the task at hand. So if you're being chased by someone and or a tiger, let's say, your body's going to release adrenaline and you're going to focus in on the best way and the most efficient way to get out of it. But your adrenaline is also released when you're under stress. Your boss getting on you for some reason, your kids giving you a hard time, family issues. Those things also affect your adrenaline, which in turn affect your colon. Same with the noradrenaline. The other thing I want to point out is the noradrenaline and adrenaline. You know, for those of us who are procrastinators, some of us need to feel the stress of a timeline to get things done, and that stress of that timeline will increase your adrenaline, which in turn will increase your concentration. You know, of course, there's that is a habit that we develop over time, and that is something that we definitely need to remedy. And we don't want to rely on our adrenaline to get things done. But sometimes some of us fall into that trap over time, and recognizing it is an important thing. Dopamine is another neurotransmitter. It is related to pleasure, and it's also used for pain relief. As you know, OxyContin was a scourge in our country. It still is. That helps release dopamine, and dopamine is something that also affects the transit time in your colon, which is why sometimes when you are taking painkillers, you're also constipated at the same time. Well, they'll give you Colace or some kind of other suppository. Serotonin is another neurotransmitter that's released in the colon. That is something that helps maintain our mood, specifically our happiness. Without good levels of serotonin, you will not be happy, which is why most of the pharmaceutical drugs are based on making sure your serotonin levels are staying at a higher level. GABA is the calming neurotransmitter. That is a neurotransmitter that's released that puts the brakes on things. Deficient GABA stands for gamma aminobutyric acid. When you have low levels of GABA, you tend to lean towards having ADHD, anxiety, different types of mood disorders, and you tend to be a restless person, and you tend to have breathing issues on a regular basis. I'm sorry, sleeping issues on a regular basis. Acetylcholine is the learning neurotransmitter, along with glutamate, and then of course endorphins, which is released whenever you are in a euphoric state, whether that is in sex, exercise, what have you. So how do we make sure that these neurotransmitters are being made and that they're being transmitted to our brain? So one of the ways serotonin is created is by turning tryptophan into serotonin. And without sufficient amount of nutrients, the correct nutrients, that process doesn't take place. So if you don't have enough vitamin C, biotin, magnesium, omega-3 fatty acids, B6, folate, or zinc, all 7 of those nutrients are needed for that process to take place. So you can see if there's one thing that's missing, that process is just not going to be as efficient. So we need to make sure that those different vitamins are something that you have in you. And most importantly, if you're taking it, they're being absorbed. So if your GI system is not absorbing nutrients properly for whatever reason, those nutrients might be deficient. And this is where testing becomes very, very important. Another neurotransmitter, or 2 neurotransmitters that we talk about that are very important when it comes to mood and your day-to-day function, is dopamine and norepinephrine. So for dopamine to be created, tyrosine needs to be converted into dopamine. And you need to have enough iron, niacin, pyridoxine, which is B6, and folate. And if you don't have all 4 of those nutrients in sufficient manners, that amount cannot be dopamine cannot be created on a regular basis. So do you think a chronic pain patient who has been seeing many different doctors should be checked for their iron levels, their B6 levels, and their folate levels, as well as their niacin? It's really, really important. And for dopamine to be turned into norepinephrine, you need enough vitamin C and you need enough copper. So going back to serotonin, what are some of the signs of someone being low on serotonin? They tend to be depressed. They'll have negative thoughts on a regular basis, even if there's no reason for those negative thoughts to be there. Anxiety, irritability, fatigue, low energy, memory issues, changes in sleep pattern and appetite, chronic pain. They lose their libido, and they tend to have digestive issues. And when it comes to GABA, which is the brakes on the nervous system, and that is something that is needed to help prevent any type of anxiety, you need to have good levels of GABA. Some of the signs of you having low GABA is increased mental and physical stress, feelings of anxiousness, increased muscle tone is what that should say. Muscle tone is when your muscles are in a constant contracted state. They don't relax very well. You're the type of person that's constantly tight and you have to stretch and it never gets better. Erratic mood swings, elevated blood pressure, and sleep disruptions as well. So putting that all together, it's obvious that chronic inflammation has a big impact on our microbiome, eventually our immune system, hormonal system, and neurotransmitters. Our gastrointestinal system plays a very key role in helping us keep ourselves physically and mentally and emotionally functioning. And the gut-brain connection is very deep and very real. The importance of the connection cannot be overstated in regards to your overall health and well-being. And that is it. If you have any questions, please post them, and Janine will ask me some of the questions that were posted.
Thank you so much, Dr. Vartanian. This is amazing. This was a lot of information, but hopefully very beneficial and interesting to all who are on with us live today, as well as those of you who are watching the on-demand recording. This presentation will be emailed out to everybody who has registered. So if there was any part that you missed at the beginning, you are welcome to watch the recording once we have a chance to edit in post-production and email it out to all of you. Please continue to type your questions into the Q&A feature of Zoom. If you have any questions that you would prefer to ask in a private, free 15-minute consultation, you are very welcome to request one by visiting us online at alignedmodernhealth.com, or you can give us a call at 773-692-6700. Dr. Vartanian practices out of our Park Ridge and Deerfield locations, as well as available on telemedicine, and our entire functional medicine team here at Aligned Modern Health would be happy to speak with you as well. We do have some questions coming in here that we are very happy to address for a few minutes. A great question that we get asked all the time that I'll actually go ahead and just take myself, Dr. Vartanian, is about insurance coverage for some of the tests that you discussed on the presentation. While some phlebotomy and blood work can absolutely be covered by insurance, the specialty kits and specialty tests like the stool kit that Dr. Vartanian mentioned is not submittable to insurance. This is not an aligned modern health policy. This is the insurance providers making that judgment call. So the answer to your question about testing being covered by insurance is sometimes, and for some of them, but not for all of them. If you have more questions about specific tests, you are very welcome to request one of those free consults. Okay, Dr. Vartanian, we have a couple of questions here as inflammation and gut health and the gut-brain connection relate to a few specific different conditions. I am very happy to ask you to give your thoughts on a couple of these conditions, but at any time, if something is too specific or is best served in a free consult versus kind of a universal answer, please go ahead and let us know. The first condition here is inflammation in relation to the dementia. Is there any connection? Is that something that you'd like to speak on?
Yeah, there is connection between inflammation and dementia. There are studies that are being run in relation to that. Some of the things that are also important in relation to dementia is making sure blood sugar levels are as normal as possible. There is in some circles, and it's starting to change, where they're going to start calling dementia diabetes type 3 because they're so interrelated. So blood sugar elevation can also cause inflammation as well. So that erratic nature of your blood sugar going up and down can affect your GI, which in turn can affect your brain. So there are, of course, certain levels of dementia where if it's very difficult to change at that point, but if you are early on in that stage, then yes, it can be.
Thank you. Same line of thinking about inflammation and gut health as it relates to a specific condition. Are you able to share any thoughts about that in relation to Parkinson's disease?
It doesn't really relate as blood sugar goes. But one of the signs, the first signs of Parkinson's disease is constipation. So if you have Parkinson's disease in your family and you have constipation, you can see how there is a neurological connection between your brain and your gut. So making sure your gut is functioning properly can slow down that process. Can it halt it completely? I'm not so sure about that part. But it doesn't hurt to find out what that is, what is causing that constipation. If it's not going away despite you taking stool softeners or increasing your fiber intake, we want to investigate that a little bit further, making sure that the gut-brain connection is connected in that respect as well.
Thank you. One more here in this line of thinking before we move on to some other kinds of questions. Inflammation, gut health as associated with rheumatoid arthritis. Any thoughts you're willing to share there?
Yeah, rheumatoid arthritis is an autoimmune disease. And one of the things we look for with the autoimmune disease aspect is whether you have intestinal permeability or not. Your autoimmune reaction is happening most likely because foods are getting into your bloodstream that are not supposed to be getting in, and that gut lining integrity has been lost, and it's causing an immune reaction. And in your case, it's happening where it's affecting your joints. Some people who have Sojourn syndrome will start having skin issues. Lupus will have the butterfly rash. So it just depends on what part of your body is being attacked by the gut lining being broken down.
Thank you. A great question about ages that we treat. And I will say that we have folks on our team that treat pediatrics through adolescents, through adults, and folks in their older years. So I would say for those of you asking about different ages or any age restrictions, very welcome to start with a free consult if that is best. But by and large, we treat patients of all ages for all services here at Align Modern Health. That same person asked another question, a follow-up about the insurance and labs. If you have labs from a different provider, you are very welcome to bring them and encouraged to bring them to your visits. However, we may do still want some additional testing with our team and our providers. So that is very specific on a case-by-case basis. Dr. Vartanian, you talked a lot about stool and stools determining, stool tests and results determining gut health. Can you talk a little bit about what we look for, color, consistency, all of those kinds of fun things?
Yeah, the consistency you want is you want it to be smooth, well-formed, needs to look like a banana. It shouldn't be in a bunch of small pieces, and it shouldn't be floating. It shouldn't be dark. It should just be brown. It shouldn't be yellow or green. Those are the things that tell me that something is off. And of course, if you ever see any mucus as well, that's also a telltale sign that something is not right. All those things tell me an idea of where the problem is coming from. It doesn't tell me any specifics, which is what the stool tests tell us.
Thank you so much. We have a couple of questions here, and we are coming up to time. So I do want to mention, if we haven't gotten to your question, please do reach out to us and follow up for a free consult, because we have so many wonderful questions here that are absolutely valid. We just aren't going to get to all of them in the time we have today. So before we do have to end, if we don't get to your question, please know that we see you, we hear you, and we do want to help. But going back to just a couple of more, a couple of questions here about probiotics and prebiotics. I know a lot of that is highly customized to each individual. Are there any generalizations that you do offer versus liquid versus capsule versus food-based dosages? Any kind of general overview on prebiotics and probiotics?
Yeah, my general feeling on pre and probiotics is it just depends on what the findings are on the stool test. This is why sometimes people will take probiotics and they'll say, oh, this did nothing for me. And sometimes people will take it and they'll say, this turned my life around, because that particular strain, it doesn't matter if there's billions of strains in there. If it's the wrong strain, it's not going to help you. And as far as prebiotics go, those foods that I mentioned really will help build up your the fertilizer, as I would say, of your gut, which will help feed the good bacteria. So those foods that were on that list will help with that. Chicory root is one of the more common ones. Inulin is another one. So those are types of foods that, when you are given, will help the good bacteria grow. And you want to make sure you're taking the right strain based on what your findings are, or else you're really just taking a guess.
Thank you. One last question here live, but again, if we did not get to your questions, please do follow up. We are here for you and happy to help. Last question we'll take live, Dr. Vartanian, is about multivitamins, the daily vitamins. We've all, started maybe with the Flintstones chewables in our younger years and have, gone up from there. Any thoughts on multivitamins, and do they really give us all of the nutrients you reference for proper absorption? Any thoughts on the multivitamin?
Yeah, there's it's obviously the Wild West when it comes to the supplement industry, and we kind of pick and choose who we work with supplements. So the multivitamins, it's all depends on the source of their vitamins, the quality of their production, and how they encapsulate it and how it breaks down in your system. And they can do all that perfectly. You can have the perfect vitamin. But like we had mentioned previously, if you are having certain absorption issues, at that point, you can take all the multivitamins in the world. You're going to be deficient in certain things because you're not going to be absorbing certain nutrients. So that's very, very important. It's hard for me to give you a specific name or brand without sounding like a commercial. I don't like to do that because it is different from person to person. But some multivitamins will help you. It's not going to hurt you unless you are taking something that has iron or high levels of copper, which can cause problems if you have too much of it. or vitamins A, D, E, and K, which are fat-soluble vitamins. You kind of want to be careful with those because if you have too much of that, that can cause a little toxicity. You know, those are the things that we monitor at our clinic, and we want to make sure that if you are taking these things, that you're not already at the levels that you should be, and we're not causing any type of toxic reaction that your liver has to deal with at that point.
Thank you so much. Thank you for all of this amazing information, for your time, and for the presentation itself. Thank you to all of you who have joined us live, and thank you to those of you who are watching the on-demand recording. We appreciate you, and we are here for you and happy to help. Our next Digital Doc webinar is on October 24th, 2 weeks from today. The topic will be adrenal fatigue and taking a look at adrenal fatigue from both a functional medicine perspective as well as the traditional Chinese medicine perspective. Again, we are grateful for you, and if you have any additional questions, you may visit us online at alignmodernhealth.com or give us a call at 773-692-6700. That does bring us to the end of our webinar for today. We appreciate you and we wish you well. Cheers.